Welcome, everyone. My name is Jared Markman, and I am the Executive Director of Da Vinci Art Alliance. We have gathered here this morning to talk to the inquisitives at the intersection of art and science, which is in Gallery 2 as part of Da Vinci Fest Live. We are very fortunate today to have Marianne Mitchell with us to moderate this discussion. Marianne is a contemporary abstract fine artist. She earned a BFA painting from Washington University in St. Louis and has done postgraduate work in Japan, China, and at the Vermont Studio Center. She is a Mid-Atlantic Arts Foundation Fellowship recipient and has shown work nationally and internationally. Her work hangs in many important collections, including the Wharton School at the University of Pennsylvania and other private collections around the USA and abroad. Today, she will be leading our discussion, and we are absolutely thrilled to have her. Marianne, I'll pass it over to you.
Thank you so much, Jared. It is indeed an honor to be here with all of you today and helping to generate some very interesting discussion about the intersection between art and science, which has always been an intersection for me of great interest. So without further ado, I would like to introduce each one of you and to hear just in a short, brief statement what your work is about, and then we'll take it from there. So I'm going to start with Barbara Bix. Barbara, welcome. Nice to have you here.
Thank you. I am a practicing physician in a community internal medicine practice, and art has always been a very important part of my life. I started working with glass about 16, 17 years ago, initially with mosaics, and over the last few years moved into kiln-fired glass and doing more glass sculpting. Those are the pieces that I'll be showing in the exhibit.
Great. Thank you very much. They look very interesting, so I look forward to seeing more. Next, I'd like to introduce Bennett Lorber. Bennett, tell us your story.
Okay, Marianne. I'm a non-representational painter. I've painted since early childhood. Primarily, I paint with acrylics on paper. I use geometric forms, squares, rectangles, triangles, an occasional circle as a kind of vocabulary. I typically paint in series. You can think of it as sort of variations on a theme, or I like to think of it like jazz improvisation, where there's a melody and then there's improvisation. And in my day job, I'm an infectious disease doctor. I recently retired as professor of medicine at Temple University School of Medicine after 45 years.
Great. Thank you, Bennett. Your work looks very interesting as well. I look forward to seeing it in person someday, I hope. Next, I'd like to introduce Christine Stoughton. Christine,
hi.
Where are you coming from today?
I'm actually on Cape Cod today.
Lovely.
So yes, it's a lovely setting to be here. And my background is I started out in special education and then went on to get my PhD in psychology. However, I always studied art and I always made art. And then later I went back to the academy and got my certificate at Pennsylvania Academy of Fine Arts. Certainly for me, I experiment a lot with non-traditional materials. And so I'm showing sculptures in the exhibit that really relies on non-traditional materials. I look to nature for my inspiration. Continue to teach. Now I teach aesthetics and studio courses.
Great. Thanks very much. And so now we move to Joellen Ross. Joellen, welcome.
Thank you. I'm happy to be here. I am a practicing clinical psychologist. although I've always loved art, and I think I've always had an artistic, whatever, bent, I didn't start formally studying art until about 17 years ago. I've sort of worked my way into it. I now do also geometric abstract paintings, usually on acrylic, occasionally watercolor. And I continue to explore and to learn and to try to develop and improve my work, which is similar to how I think about myself also as a psychologist, just continuing to learn.
Wonderful. Thanks very much. I look forward to seeing your work in person as well. Let's see. Now we're going to hear from Linda Dubin Garfield. Hi, Linda.
Hi, good to see you. I haven't seen
Yeah.
you in a while.
I know.
Right. I was a educator. I was a teacher and a counselor in the Philadelphia school system for 38 years. And I was an art hobbyist, but I always wanted to be an artist. So when I retired, I took my own advice and followed my dream, which was to be a full-time professional artist. And in the early 90s, I took a printmaking course and fell in love with the process and the press and the smell and squish of the ink, and the whole thing just was my thing. And then I started using mixed media and digital technology in addition to the traditional techniques, and used my love of travel and the mystery of memory and the magic of place so that my works on paper are a reflection of what I see with my eyes and the truth of what I feel in my heart.
Wonderful.
And yeah, it's been quite an adventure.
And will continue to be so.
I certainly hope so. Thank you.
Okay, and Pia de Girolamo. I hope I've said that correctly.
Hello, it's Pia Di Girolamo. Hi, Marianne.
Thank you. Nice
Good
to see you. Pia.
Again. Yes,
Great to
yes.
see you.
So I am an infectious disease physician, like Bennett, and I changed course a number of years ago and switched completely into being a full-time artist. So I have an encore career, I guess one might say. I am primarily a painter in acrylics, and my subject is usually the landscape. I would consider myself an abstract representational painter. So a landscape, for example, that I might do, for example, this one behind me is one of mine, is an abstracted landscape. And I also take my inspiration mainly from nature. And my most recent series has been based on a trip to the Arctic Circle, to Svalbard, way north of Norway. And the pieces that I will be showing in the exhibition reflect that series, a part of that series.
Great, thank you so much. I'm so excited to see all of your work together in however way that we can, because it sounds to me like each one of you are making pieces that are quite different from each other, and it promises to be a very exciting show, I'm sure. So I would like to kick off the conversation with hearing from all of you in your respective ways about how your background in science influences the art that you're making. And so I turn that over to you and to see who would like to kick off the conversation.
Well,
So I'm going to play.
Moderator.
Yeah, exactly. So Christine, your voice came in a nanosecond before Linda's.
Well, I just want to say that I think when I first started studying psychology, it was Introduction to Psychology 101, my freshman year in college. And the professor said, "What is psychology? Is it art or science?"
Okay.
Literally, that question has stuck with me throughout my career. So I've looked at both sides of that as a practicing psychologist, but also looked at the psychological underpinnings of art and the perception of art. And it's all gotten woven together. And I think one thing that therapists and artists share in common is they really help people see things differently, see things in a way that they're unable to see necessarily on their own. And so it is very much about turning oneself over to the process, whether it's the process of making art or the process of engaging in therapy with someone, the process of change. So it requires a student awareness and willingness to experiment with the flow when you don't know ahead of time what the outcome will be.
Okay, thank you, Christine. Linda?
So I had a similar thought that art and science are both ways that people try to understand and explain the world around us. So we use different techniques and we have different audiences, but the motivation is essentially the same. Like how do we make sense of the world that we live in? And because we're social creatures, we want to share what we know, or we want to get it out there. So with the art, you want your art to be out and have people react to it. And that's part of the motivation for me anyway, to make the art. I make it for myself, and then I make it to share with others. And one of the big things that I learned, I have a degree in educational psychology, was the layers. Like when you, as a counselor, when a person comes in and presents themselves, that's like one layer is what you see. But then as you work with them and get to know them, you find other layers and you find out more information and more information. And in my prints, I do layers, a lot of layers. So it's, adding information and getting it to be, where it becomes the whole rather than just parts. And it takes time to figure that out with people, and sometimes it takes time to figure that out with art.
Okay, thank you, Linda. Pia, jump in.
Okay, I actually, as I transitioned from being a physician to practicing medicine to practicing art, as I intensified my practice of art, I began to notice real similarities between how I practice both. And one of the first things that I would say is both art and medicine or science are data driven. At the foremost, we're both, we are observers. So we as physicians, as scientists, as artists, we observe the world around us, our patients, and et cetera. We gather data. We gather sense data, we gather visual data, and so on. And then we distill it into a diagnosis for a patient or into a painting. So those were the things that as I worked were coming up over and over again. And when we then distill everything, we want to communicate that. I think others have mentioned this already. We want to communicate that, our findings, in a sense, and show or tell other people and hope it either heals them or awakens them. And so those are some of the ways that I was very conscious of the way I thought about my practice of medicine impacting or being the same, very similar to my practice of art.
Thank you, Pia. I think, Barbara, did you want to chime in?
I did. So in a slightly different area, glassworking is really like doing chemistry. It's a very exact science. and it requires an in-depth understanding of both the chemical and physical properties of the glass, and the aspect of creating something entails learning all these different pieces of information and choosing the correct firings and figuring out how the science of it allows you to then create something, unique and beautiful. So there really is a lot of basic science behind what I do.
Okay, thank you so much. Bennett, do you have anything to share about this relationship for you?
Sure. So Linda mentioned that both science and art help explain the world around us. And I would add to that I think both science and art sort of push the boundaries of what we know. They help us to know more and explore new areas. For me, my work in medicine doesn't directly inform my art. The opposite is true. The art informed my work in medicine. The one way in which I feel that my experience in medicine has impacted my art is in problem solving. So doctors and scientists are problem solvers. And when I conceptualize a painting, I spend a lot of time sort of doing little thought experiments about what is the best way to get this picture in my head, out of my head and onto the paper. What should I paint first? That kind of question. And my experience as a problem solver helps me in that arena.
Great, thanks so much. Joellen, let's hear what your—
No, I can tag on to what Bennett is saying, because a common question that I've gotten over the years in my practice is, how can you stand listening to people's problems all day? And my response is, I don't hear them as problems. I hear them as puzzles, as something to solve, as something to explore, as something to understand. And I paint my painting process is rather similarly. Oftentimes, I don't know what I'm going to do. I'll just put something on the canvas and create a problem for myself that I have to hopefully solve visually. So in that regard, it's a very similar process. But I think what continues to inspire me both in my day job and in my artistic practice is the opportunity to keep exploring and learning and discovering. I mean, there's always something new. And I taught at a medical school for about 10 years. And the one thing that I could really understand about people's love of medicine as a career is there's always something new to learn. And so I could really appreciate that. So I think all of us have to be learners.
Lifelong.
Yeah.
So all of you are visual artists. And so I'd love to hear your comments on the relationship between science and creating visual art. You've chosen to create art in a visual way as opposed to writing or dance or acting, and whether it's three-dimensional visual art, or some of you are crossing the divide between three-dimensional and two-dimensional. But it is, we as painters and as sculptors, we are creating visual art. And so I'd love to hear about the relationship between science and visual art.
For me, if you heard me sing, you would know why I'm not into music.
I
I
love it.
ballet for a very short time, but that wasn't me either. So I think it was just the luck of the draw that, I got some skill in art, which I didn't get in some of the other areas.
Okay. Any other cross between the two?
Well, certainly I think what we talked about as far as being an observer, it requires keen observation and experience. And it requires extracting a quality out of that experience that you wish to communicate to somebody else. So for me, again, that's easiest to do visually.
Mm.
Okay. Anybody else have thoughts about the relationship between your visual need to create and your scientific practice?
Mm.
Well, go ahead. Go ahead, Barb.
I was going to say that, I mean, to me, both the science and the art touch on something that Bennett said, that it's about problem solving and trying to figure out how to help somebody, how to create something, how to end up with where you want to be. And I think that those are very similar in both. And I also think that science and art are about storytelling. I think that when I see patients, that they have a certain story that I need to listen to and use to come up with a solution to what's going on. And I think that my art, though I don't always know where I'm going to end up, that ultimately it tells a story.
Mm.
Okay, Kia?
So for me, I guess because my initial, the things that make me excited or it spark wonder or awe are visual things. I've been able to do a lot of traveling to some really beautiful wild areas. So my first experience of these places is visual, or the most immediate, the most exciting is visual.
Mm.
And so that hits me really, really strongly. And then I have the feeling, the urge to translate that, to preserve that, to enhance the memories of that visual experience and put them on another visual, or create another visual experience for myself and for others to experience some of what I saw in real life, in reality.
Mm.
So I think for me, that's where the tie-in to the visual art comes in. It's just really simple, look at a mountain, I go, wow, come back to the studio, and I want to recreate that. Wow.
Yeah.
But when you were practicing medicine, did you have the same experience in your research and
Visual is,
there was a
yes.
visual excitement at what you were seeing as a doctor?
So that is actually really fascinating that you mentioned this, because especially in infectious diseases, one of the things, but in all aspects of medicine, one of the things you have to train yourself is to listen, number one, in a very open-minded way, but you have to train yourself to see. So you look for, what does the skin look like? What are the markings on the skin? What do the veins look like in the neck? Are they flat? Are they elevated? That all of these little things, point you to a diagnosis. It's like a puzzle, like Joe Ellen said, and you put these pieces together. But there is a very visual component to what you're doing. There's other things. You listen with a stethoscope or to someone's story, but you have to really look. You look at their fingernails, you look at their mouth, you look at their eyes. It's fascinating, and you come up with a picture.
Yeah.
So yes, very, very similar.
That's great. That's a great description. Christine?
Adding on to what Pia just said, in working with people in whether education or therapy, most of the communication is through body language.
Mm-hmm.
There's words, but then when you pay attention to the body language, you far more information than you do if you're just listening. And so that is itself visual. And it also has to do with movement and change, which aspects that I incorporate into my work also.
Mm-hmm.
Great.
It's interesting because I do static images, but like the one behind me is one of my prints, and it's about the movement of water. So I try to capture movement as well as the image itself.
Great. Thank you. Linda, did you want to add to that?
No.
No. Okay. I thought I saw you. And Bennett.
Yeah, I'd like to tell a little story which I think illustrates some of this. Visual artists are good observers. We're trained observers, and being a painter has made me a better doctor, more able to do the things that Pia described in terms of really seeing the patient. But for me, it's also been seeing around the patient's environment. If you can bear with me, I'll just tell you a quick story. There's an unusual kind of pneumonia that people catch from birds, and it's called psittacosis. And psittacos is the Greek word for parrot. So it's sometimes referred to as parrot fever. So one day I was asked to consult on a patient who was hospitalized, had been in the hospital for 5 days. He had had a bone marrow transplant. He had been doing very well, but then he developed a pneumonia, was admitted to the hospital, was quite ill, was put on standard antibiotics, and after 5 days was no better. And so I was asked to see him. So I reviewed the chart, then I looked at his x-rays, and then I went into the room. Patient was lying in bed looking quite ill. His wife was sitting on the bed holding his hand, and I introduced myself. And on the night table next to his bed was a framed 8x10 color photograph of the patient with a giant parrot on his shoulder.
Oh.
So I said, "Excuse me, folks, I'll come back." And I left the room and found the doctor who had consulted me, and I said, "Very funny." And he said, "What's funny?" And I said, "You asked me to see a patient with an unusual pneumonia, and there's a picture of him with a parrot on the night table." To which he responded, "There is." And so on the basis of that photograph, we made a diagnosis. We changed the antibiotic to a specific drug for psittacosis. We ordered the test. The patient improved overnight, went home the next day, and subsequently was proved to have it. But many doctors had been in that room and didn't see it.
That's a great
That's
description.
great.
Thank you for sharing that, Bennett.
Story.
Yeah. Joellen, did you have something to contribute on this, or?
Yeah, I was thinking about what Christine had started off by saying about science. Is psychology a science? And yes, it is. And there's always that that which we don't know component, but that seems to have an effect, which I think is also true in science. And certainly when I worked with physicians, I found that the best physicians were the ones who were able and willing to admit what they didn't know and to engage in problem solving with their patients, which is certainly something I do with mine. But I think it's important for all of us, whether scientists or artists, or in both worlds, to remain open to that which we don't know, and open to learning, and open to observing, as Bennett did, noticing the parrot. I mean, I walk out to my waiting room and I can often tell just by how somebody's sitting what kind of emotional state they're in. And there are always these factors that are hard to pin down, but that are very important.
So it sounds like, in terms of what art and science has in common, that keen observation skills and problem solving skills are the two things that all of you have said a couple of times are the connecting pieces. Is there anything else that you would say art and science have in common outside of the problem solving and the observation skills?
I think that they, as I mentioned, I think that they both tell a story. And I think that the story is what you represent either by your painting or your sculpting, what you're telling somebody about something that's important to you. And that I think that medicine, psychology, that there is a story if you listen from your patient, and understanding that allows you to move forward into treatment. So I think that the storytelling aspect is one that's important in both fields.
Right, that's you're absolutely right, Barbara. Thank you. Linda?
Yeah, I think the other thing is that artists and scientists try to see the world in new ways. So, you know, you don't want to do the same picture over and over and over again. You want to try something new. You want to have some unique thing that you do that is. And I think scientists also are looking for new explanations and new understandings. So in the laboratory, they would do the same thing that we do in the studio.
Great.
It's the same process, just different materials.
Okay, thank you. Pia?
Yeah, I think one other quality that is similar, certainly the best physicians and in really good art, or I should say at least in the process of being a good doctor and of being an effective artist, I think is a quality of openness, open-mindedness, not closing off options until the last possible moment. That's hard to do. I think we just in general as people, we want to wrap things up nicely and with a nice little bow. But and we tend to jump to conclusions, but we have to, in both art and medicine, really wait, really explore options, possibilities before we come to that conclusion. And even then, things may not be completely closed.
Great, thank you. Joellen, did you have something to contribute to?
No, I was just agreeing with what with what Pia was saying. So
I think it's I'm so heartened as an artist myself who's interested in this intersection that all of you are visual artists, and I'd like to hear how and if you in your respective fields have encouraged your peers, your colleagues to get involved or engage in creating visual art, or sharing your experience as a visual artist and how that can benefit other people who are medical practitioners. Bennett, your story was what made me think of this question, and whether your colleague who didn't see the picture, whether that whole experience encouraged a conversation about you being an artist and being able to see that picture.
Yes.
So can you all share about how you have been almost like an emissary for being an artist in the scientific world?
Well, if you could bear another story, I'll say something about that. Pia talked about how doctors seeing patients have to be acutely observant. And one of the things that I did when I was teaching medical students at the bedside was to play this little game. So after I had been with the students for a few days and they knew that I wasn't going to eat them and that I wasn't a monster, we would go to see a patient and I would talk to the patient for a few minutes. Then I would say to the team, so the team is probably a resident, an intern, 3 students. I would say, everyone turn around and face the wall. And then I would touch one of the students on the shoulder and say, tell me one thing you noticed about Mr. Smith or Mrs. Johnson. And they would often say, she has an IV. And I would say, that's right. Where is it? Is it in her left arm, her right arm, her neck? Where is it? Very often they couldn't answer that question. I'd ask another student, okay, now you tell me something you noticed. And that student would almost invariably say, I was going to say she had an IV. And then, and this is in some ways a cheap trick, but extremely effective. And then I would rattle off a long list of things that I had observed about the patient, which included, in addition to the patient, whether there was a Bible on their night table or whether there were photographs of grandchildren and the like. The next day, going into a room with the same group of students, they're all looking around and they paid attention. They learned to observe because they knew I was going to ask them and they wanted to be able to respond. And I found that a very effective way to help people to be better doctors by teaching them to be more observant.
Mhm.
Thank you so much for sharing that story. And Pia?
So it's interesting because this circles back to the whole lifelong learners, being lifelong learners that we were talking about in the beginning. And Bennett is talking about training residents or students, and which is really important. And medical schools, as some of you might know, have programs in place now using the visual arts to train their students and residents. But it's still important for us older folks, as people go on in their careers that who haven't had the benefit of that kind of training, who have but need a refresher, to have that kind of thing. So a few years ago, I was asked to put together a talk, which I presented to alums, older physicians who, or I shouldn't say older, but people who are well on in their practice who were at a conference, and this was presented as a conference topic, the intersection of art and medicine and how art can inform your practice as a physician. And so I have done that as a lecture, a PowerPoint presentation. In addition, there have been physicians that have come to me kind of privately, not so much really to use art to inform their practice, but to perhaps use it as more of an outlet and discuss with me, how did you do this? What should I do? Et cetera, those kinds of things. But it was very gratifying making this PowerPoint and delivering it, because I think some people had an aha moment and were had never really thought about this concept of art and science being interconnected.
Right. Great. Thanks. Christine.
I teach at the Barnes Foundation, and that is a program for lifelong learning for sure. And in my classes, I get a large number of engineers, medical physicians who come because they've always been curious. They've always never really had the time to explore it. So they do come and they contribute a whole lot to the class because they have their own set of experiences and their own view of things. And so it makes for a very dynamic exchange between, and we get, I have a lot of artists in the class. So it's a ever evolving and where everybody learns and sees more because of the intersection.
Great, thank you. Anyone else want to chime in with this?
Yeah.
Yes, Joellen.
Yeah, I found, well, I know a number of psychologists, not just Linda and Christine, who also are artists of one stripe or another. But I've also found the use of art in my own practice has been very rewarding. There used to be this kind of old-fashioned notion that your office should be this blank screen, very plain, nothing personal, nothing challenging. My office and my waiting room are quite different from that. There's lots of art, lots of bright colors, lots of things happening. And I find that people walk in and they look around, and their responsiveness to the art is really wonderful. People relax, people ask about it, people like things, people hate things. It starts conversations. It's really been wonderful. And I like being able to share that. I mean, it's not just, you know, I have some of my own work up, but I have a lot of other things as well, including a painting by Pia. And that people just love, and that's very gratifying.
Right. Anyone else? Linda, did you have something
No.
to say on this? Okay, great. Well, I'd like to turn to a question that seems to be one that is on the tip of a lot of people's minds, and that is how science and art can be an important can have an important role in the current political climate and with the current pandemic going on. I'd love to hear all of your thoughts about the relationship between the political climate and the pandemic and art and science. I mean, that's a huge juggernaut of things right there. But I do think it's been very interesting in my own practice to see how people have turned to art in the last 6 months as a place to use extra time to discover themselves or to find solace and make themselves feel better through making art, even if they hadn't been making art before. So I'd love to hear you speak about the relationship between art and science, the pandemic, and the political climate in many different ways. So who would like to tackle that one first?
Well, I'll say that I think that science, particularly medical science, will lead us out of this pandemic, and that the political climate is making the pandemic worse than it needs to be, and that in the meantime, until science does resolve this disaster, that art, making it, but also seeing it, offers, as you say, solace and comfort, and at the very least, a wonderful distraction and an opportunity, at least for me, for optimism in the face of what is day-to-day a very stressful situation, not looking very optimistic all the time.
Great, thank you, Lynn.
I agree, and I think here we can talk about the visual arts and the museums being closed, and now that they're open, people are going because they do miss seeing the art. And also the theaters and the movies and TV and music and all of the arts. This is where all of the arts are really important to get people through. And luckily for us, I mean, I can't imagine what it was like in 1917 when you were in your house and you had nothing. When here, the whole day goes by and I can watch Acorn and Zoom and do all the, keep me involved in the arts and see Shakespeare and see the Philharmonics play. You know, it's amazing what's out there and what is at people's fingertips to help us through this very difficult time. So the arts are really an important aspect of life, and it bothers me and it upsets me because financially the arts are suffering terribly, and the cities don't have the money that they used to have because they're not collecting the taxes or whatever to help with keeping the arts going. I'm concerned about what's going to happen in the long run with a lot of the arts programs, and hope that we'll be okay.
Okay, thank you, Linda. Who would like to,
Um,
Joelle?
Yeah, I think that one of the things that has been revealed in the current climate is that for some folks, both art and science have seemed like things for somebody's else, have seemed that they're not available to them. And you know, one of the things that's excited me about this Da Vinci Fest is its openness and its outreach and its encouragement, and it's making art and science very accessible. I think that uh, both art and science need to do more outreach to seem less scary, less out of reach for a lot of folks. And that we need to, in both realms, be more welcoming and encouraging so that people can accept it.
I have a question about that, and that your points are great. I'm making it less scary. You know, this goes back to being to open-ended, and I think that that's really a difficult thing for people. Like, for example, at the beginning of the pandemic, there was a lot of misinformation or not enough information about masks. Whether it was intentional or not intentional. But what happens is in science and medicine, you don't know all the answers in the beginning. And you know, once you realize what a possible answer is, you know, you switch course, you change course, and you follow that course. You get the data, and that's not good enough for a lot of people. How do you transmit that is part of what science and medicine are all about? We don't have all the answers. We can't give you all the answers now. We're doing our best. What we're doing is working hard. And if we got to change course, we change course. It's how do you show that? I mean, it's sort of like almost like and you can relate it to art. Let's say I just use the Impressionists, you know, as a easy example. So the classical painters, the people in the salons were getting, you know, all the shows, the Impressionists come along, and people are saying, what is this horrible painting? You know, like, I can't accept this change, this difference in seeing something. And it took so long. So how does anybody have any idea of how do you promote? Is it that we as scientists or artists, we don't focus as much as we need to on that aspect of we're gathering the data and we've got to revise our conclusion? I don't know.
Anyone want to chime in on that?
Well, Pia, my answer to that really important question is that I think we need to do a much better job teaching in elementary school what science is and what science isn't, and helping people to be more comfortable with uncertainty and ambiguity.
Ambiguity, absolutely.
And people have the idea that there is no ambiguity in science,
Right.
that there are, you know, tell me what the facts are, you know,
Right.
what are the 6 causes of fill in the blank? And as you point out, this is an ever evolving. I mean, this pandemic, this is extraordinary. You know, this virus is unlike any virus we have ever seen. And we're learning more about it every day. And as you point out, if we did a better job teaching people early on what science is and how it works and how to think about problem solving, I think people would be more comfortable dealing with the stress of the unknown.
So I have a question about that, Bennett. Do you think that it would enhance both the learning about science and art in helping to understand the uncertainty and the ambiguous aspect of science if learning how to, let's say, create abstract art was paired with learning about science, and so that there would be an element of learning about science from an artistic perspective of putting into practice in making art element of uncertainty and ambiguity, and then drawing the correlation to how that is an important ingredient as well in scientific research.
Yes, I think that's a great idea.
Absolutely.
And you know, when one of the courses I teach it's called The Decisions Artists Make. And in that course, I really focus a lot on the process of making art and show a lot of artists who allow their process to be seen rather than presenting a completed, finished, what we would consider perfect, where they see the changes that the artist makes and allows that to remain on the canvas or to remain in the print or to remain in the sculpture for the viewer to see that it wasn't just a one-step process, and get a sense of those changes. And I think that directly correlates to what we're saying. I remember the sculpture class I ever took, I did the sculpture and said to the teacher, well, now I have to clean it up. And she said, no, you don't have to clean it up. She said, that's a decision you make. You can allow the viewer to see process and to see how you started and where you got to, or you can clean it up and hide your process. She said, that's a basic decision that artists make. And I think it relates to what we're talking about, having to educate people about the experimentation and the learning that's involved in science too.
You know, I think this is actually all part of, you know, a tendency lately towards authoritarianism. It's very interesting. I think that, you know, the tendency towards authoritarianism is one in which, again, people are seeking answers, people are seeking stability, people are looking for somebody to say, you know, we do it this way and this is the way we're always going to do it. And I think some of these things, abstract art, learning to be open-ended, learning, you know, to, you know, all of these things can inoculate one against the tendency to accepting any dogma from on high. And it would be great if we could encourage or put in systems like that in schools where people can, where children can learn to deal with those decisions, ambiguities, etc., without freaking out.
Right. Thank you, Pia. In closing this very provocative discussion, I'd love to hear what your final comments are about the relationship between art and science, and both in your own practice and how, as artists and scientists, you can help to shift the energy in the world. Or shall we leave it at that?
Yes, we should do that. no, not literally.
Exactly how, I don't know. We'll figure it out.
I would like to say that I have a belief that by generating the kind of energy that we all as visual artists, because all of us right here are visual artists, by generating the kind of energy that you all have been talking about, the employing the unknown and allowing yourself to be open to change and using change as an effective tool in the creative process, and allowing the element of spontaneous action and strategic decisions, and those two things weaving together to create something whole. That in fact, in the discussion about art and science, the, you know, seemingly two opposite ends of who we are as humans, but coming together to create a whole human, a whole piece of artwork, this relationship between the unknown and the known. that by having us employ that relationship in the energy that we're creating by making the art that we're making, that we are in fact putting that wholeness of energy out into the world merely through our own creative action of bringing these two worlds together. And by doing that, we are, and I believe, as a non-scientist, I do believe that science has proven that the energy that you put out does affect the energy that's already out in the world. So if we are putting this energy out in our own tiny little respective ways, the collective energy can shift. And so I believe that that is a crucial role that all of you have as both scientists and artists, to put that combination out into the world now. We need it now more than ever. Yeah.
Well said.
So just well said, and it sparks two things. One, I think that art and science were always, in the past, one entity, and over the years there's been a split, like a schism, duality, where they really are not. And I've had artists say, "Oh, I don't understand scientists and science. Oh, I have no, concept of that." And then scientists who say, "Oh, art, that's just so different." People are in their own little camps, and it's very strange to me. And I think, and I see this more and more. I think this panel, this Da Vinci Fest is sort of a manifestation that I think they're coming more and more together again. I think that's really important. And the second thing I want to say, sort of bouncing off what you had said, is I remember the phrase somewhere about artists and people who are making art in a particular period of time are contributing to the culture. So we don't know exactly how we are contributing, and it may be very small, but as you said, together, there is a contribution there. We are, like dinging the little strings in the spider web and having them kind of, or putting the pebble in and having, the rings just move outward. So
there are limitless examples of that. And just like in voting, each person says, well, what's my vote going to matter? And it has been proven that it matters greatly, each person's vote. So in that sense, it's the same thing. Anybody else want to add to that?
I think they said it, and you said it very well.
Thank you.
Yeah.
Thank you. So I invite all of you to go forth. I think that the Da Vinci Fest is a marvelous opportunity for people to see how these two worlds come together, because Leonardo da Vinci was probably the greatest human being who ever lived on Earth, that brought these two worlds together. And it's so exciting to see that the world is coming back around to bringing wholeness to the foreground instead of fracturedness. And that's what you're doing, both as scientists and artists, with this exhibition. And I hope everyone listening to this will really enjoy studying your work and contemplating this relationship and taking that and contributing to the world as a result.
Thank you.
Thank you.
Thank you. Thanks, Marianne.
Garrett?
That was great.
Amazing. That was so good.
That was great. That was fun.
Really.
Marianne, you were great. Thank
Yeah.
you.
Oh, yes.
Very good.
Great
Thanks so much.
question.
Wonderful.
I didn't want to be too much